Okay, I'll keep my eye on the manage participants area. So if I look away, I apologize. My name is Kathy Anderson. I'm a family practice physician and I'm the director of the Student Health Center. So welcome all of you to a little chat about health and wellness services on the Sonoma State campus. I'm going to talk with you a little bit about our counseling program, CAPS and Psychological Services. Let me just get somebody else admitted here. There we go. And we work very collaboratively with CAPS at the Student Health Center, but we're separate departments and we're located in separate buildings on campus. But we do refer patients back and forth to each other frequently and help each other out when students have medical problems that sometimes will bridge mental health and physical health. And so we understand that and we work very carefully together to make sure that students have access to whatever services they need. So let me tell you first a little bit about the Student Health Center. We are located on campus just north of the library, and we are the only department that is open and occupying our building during this time of shelter in place and campus closure. And that's really important because we do have some students still living on campus. We have a lot of students who live off campus in the area around Sonoma State. And we are the primary care medical providers for many of our students, if not most of them. And at this time of so much going on in the health care field, we felt it's very important for our students to be able to access whatever care we can provide for them so that they don't have to go out into the community and go to an urgent care or an emergency room unless that's necessary and appropriate. And so we're trying to provide care and be as consistent with the care we've been providing. Many of our students are coming back in now or calling us because they need prescription refills or need some lab work done, things that we're very capable of doing for you. So the Student Health Center is staffed by a group of family practice doctors like me, nurse practitioners. We have wonderful support from a group of registered nurses and medical assistants. We do have our own on-site pharmacy. Our pharmacy only fills the prescriptions that are written by our providers. That means you can't bring a prescription from your doctor at home and have our pharmacist fill it unless you also consult with one of our providers. Can you all hear me now? Sounds like somehow I got muted in the middle of that. So I'm gonna start a little bit back here and make sure that you caught the beginning of my talk. I'm Dr. Kathy Anderson. I'm the director of the Student Health Center, and I'm going to talk to you today about student health services as well as our counseling and psychological services program. There is a group chat. You can send messages, but only I can see them. And I will either respond to your chat during our talk or else I will get back to you after the talk. Thank you for letting me know, Jordy, that you could hear most of what I said, so I won't start all the way back at the beginning. Thank you. In the Student Health Center, again, our staff are physicians, nurse practitioners, nurses, medical assistants. We do have a pharmacy. Our pharmacy stocks not everything a CVS does, but we stock the medications that we most often prescribe. So for instance, a range of antibiotics, birth control pills, pain medicines that are not opiates, things that students many times need. And one of the best things about our pharmacy is the price. We are not set up to bill health insurance, so instead we just make any services that we provide that students have to pay for. Basically, those things are provided at cost. So our typical prescription medication is $5 to $10, which most students can afford. And it's also very easy to access when you're on campus, and there's never a line at the pharmacy to pick up a prescription. So that's a really nice thing. Our providers can and do call prescriptions into outside pharmacies all the time, whether they're in Rohnert Park, where the university is located, or remotely right now with many of our students, most of our students not living in the area. We are continuing to provide health care, and we're doing it by telephone medicine or video medicine. We recently did gain the capability to use a form of Zoom that is for healthcare. And that means it is particularly safe and encrypted, and it took a little bit more time to have access to that, but we do, so we're now able to do video visits with students. We got creative prior to that, and when students were calling in with things like rashes, we would have the student take a picture of the rash and upload it through our patient portal so that when we're talking to them on the phone, we can actually see a picture of what they're trying to show us. So we've worked around a lot of things, but I think having access to Zoom will really, really benefit how we're able to provide that telehealth care going forward. And we're fully prepared to do that through the summer and even into the fall if that's necessary. So we are seeing students face-to-face when necessary right now, but most of the care, again, I would say 90% of it, and that's true across the CSU health centers, is being provided on a different platform, either by phone or by video. Our basic level of services is that we provide acute or subacute primary care, most illnesses, injuries, primary care level mental health, the things your family doctor at home provides. We are trained and prepared to provide that level of care for students. We don't manage chronic illnesses like diabetes or underlying medical conditions, say Crohn's disease, things like that. But all of the providers on our staff, including me, have practiced in the community. And so what we can do is help students get connected with local specialist providers. If you're from out of the area and let's say you need a GI specialist, we know those doctors well in our community and at Kaiser, and we can help get you connected with someone in the community to manage that chronic medical condition. So what we're doing now is trying to provide the care as best we can, and we are going to be in our building in the fall, able to see patients, see students when they're in, if they're in the area. And we don't know yet, that the decision has not been made about whether we will be providing instruction remotely, but we are prepared in the Student Health Center to manage healthcare both in person and remotely, including through the fall. And so, let's see, what else can I tell you? Oh, well, first of all, just the basics. The care that we provide is covered by a student health fee that all enrolled students pay. That fee covers everything that we do for you in-house, with the exception of those pharmacy items, which are very inexpensive. We do have x-ray capability. There's no charge for an x-ray if we take it in our facility. We have a laboratory as well. We do some very basic lab testing, things like testing for strep throat. We can test for flu. We actually are prepared to test for COVID-19 right now. We have, from the very beginning of this pandemic, we have had a very close relationship with Sonoma County Public Health. And because we are an area where a lot of people are living in close quarters, they have been very supportive of our Student Health Center being able to do testing. And those tests, we haven't needed to test anybody at this point, but going forward, if we do, those tests will be sent to the Public Health Department, and there's no charge for that test. So we feel like we're able to provide a good breadth of services for students, even in these unusual times. All those things that we do in-house, the visits with the providers, our lab work that we do on site, the x-ray, those things are covered by your student health fee. There is no copay, there's no out-of-pocket costs. And that's the way we like it. Because at the CSUs in general, students are not mandated to have health insurance. It's wonderful if students do have health insurance to cover more extensive medical care, like would need to be provided at an emergency room, but you don't need health insurance to come to the Student Health Center. Like I mentioned earlier, we're not even set up to bill health insurance, but we're all, as providers, very familiar with how health insurance works, so that if a student does have a need beyond what we can provide, then we can help that student connect with a community provider or direct them to an urgent care or emergency room if that's the level of care that's needed. Usually we don't send students to urgent care because we can provide the same level of care that the urgent care can. But sometimes students, let's say I saw you and we thought there's a possibility you could have appendicitis. Well, that's going to require more extensive testing and evaluation. That would be done at a local emergency room, and we would make sure that that all went the way it should in terms of helping you get access to that care. So I'm going to back off a little bit. I'm going to share my screen here because I just want to show you our website. Let's see if I can make it happen. Here we go. So this is the Student Health Center website. It's got our number up here in the left upper corner. You can also email us, and it's further down on the page, but our email address is centerhe, so that's CENTERHE @sonoma.edu. That that email is checked many times a day by either our administrative assistant or myself. And if you have a specific question after this presentation today, say about immunizations or medical care that you anticipate you might need if you were to come to Sonoma State, please don't hesitate to either call us, but email is usually a good way to communicate with us. I want to point out this red box, My Health Portal. That is one of two ways that you can access a secure portal, very similar to what if you have Kaiser or pretty much any sort of health insurance or health of private physician or clinic that you work with. Everybody these days has a patient portal, and we do too. So this is a way for you to communicate with us. You can upload, and this is where you upload your immunization records, is through the portal. You can enter your personal medical history. You can electronically sign forms that we need to have you sign, such as a consent for telehealth. There's a specific patient consent saying that it's okay with you if we connect with you by phone or via the video conferencing. So all that can be accomplished through the health portal. And there's also a secure messaging function there where you can, if we need to communicate with you, say about some lab results from some testing that we ordered for you, we would send you those results through the portal. You would then receive an email through your SSU email account alerting you to the fact that you have a message. It doesn't say what the message is. It just says, go check your portal message, secure messaging function. And then you can have a very secure back and forth with your medical provider. Email is not considered a secure way of communicating in medicine, but this method is. So that's a really nice feature so that you can receive, information, lab results. A lot of classes in the School of Education involve needing a screening for tuberculosis. That is going to be a requirement of all incoming students this fall, but let's say you need another copy of that form. All of that can be accomplished through the portal. So I said this is one of two ways you can access it. The other way you access it is through your My SSU desktop, and that desktop has various buttons on it for email, for financial aid, and it also has our red button, I guess you call it, for My Health Portal, and that takes you right to it. When you click that button, it has you enter your SSU login again, just to keep it super secure. You enter your date of birth, and then it takes you right to your individual page. And once you have an SSU email address, you will have access to that portal, and that will happen. If it hasn't happened as of yesterday, it will happen this next week. So can student health fee be waived? Question I'm seeing over here. The answer is no. It is one of the mandatory fees, and that provides everything we do in the Student Health Center is covered by that fee. And it's the kind of thing that it just doesn't work for us to be able to exist and have staff when we don't know from one semester to the next who's going to pay the fee. So we offer the service to all students. And not only does what we do take care of you as an individual, but it takes care of public health issues. And oh boy, is this a time to talk about that because of what's going on with the pandemic. As the director of the Student Health Center and having been a physician for over 30 years, I've been very much involved with our campus response to the pandemic. And so that's part of what the student health fee pays for, is making sure that we're doing everything the right way on our campus to protect students and staff and faculty should we encounter a situation just like we find ourselves in right now. So, that's the answer to the waived question. Somebody asked about counseling. Let's talk about that, and we'll segue into counseling and psychological services, or CAPS. CAPS is a separate program, as I mentioned earlier, its purpose is to serve the mental health needs of students, and they do that in a variety of ways. CAPS is staffed by very experienced mental health professionals. They're usually PhD counselors, PsyDs, licensed clinical family social workers, and they all have bring a breadth of experience, and many of them from College Health, which provides, a really good background and backdrop for providing mental health services. They at CAPS, they do individual counseling, they do group counseling and workshops, they do crisis management. CAPS is also the home of our confidential advocate, a woman named Susan Polito. She provides tremendous support for students who've gone through traumatic events, particularly things like sexual assault, intimate partner violence, stalking, bias-based incidents. All of those can be, Susan's role as the confidential advocate is to support students as they navigate those very traumatic events. And she is just a wonderful add-on to our campus over the last few years. We're actually going to have a second confidential advocate in her area, which will be additional assistance for students. CAPS, like the Student Health Center, CAPS is funded by a separate fee. And just like the Student Health Center, there are no copays. And so for many students, it's a very important resource for mental health support, whether it's an acute problem or a chronic condition. And CAPS, just like the Student Health Center, we help students connect with on-campus resources as well as off-campus resources. We're all very familiar with, the providers in the community and can help students, whether they have insurance or not, navigate how to access those services out in the community if they're beyond the scope of what we can provide for you on campus. We refer students to CAPS all the time, and they refer students to us who may have a medical condition that could impact their mental health as well. So we work, again, very collaboratively and very closely, but we're both very confidential, and even CAPS and student health providers do not share information about students unless the student has given both of us, both CAPS and student health, their specific written permission for us to talk about your care. And so that's always under your control. And we are it's very important to us that students understand how important that confidentiality is. CAPS is working remotely right now. We all had to turn on a dime in terms of how we're providing care. And for CAPS, they are not on campus, but they are answering their phone Monday through Friday. And then you're connected with Tara, who is their administrative assistant, and she schedules appointments with one of the providers. They are all working from home. They do video visits as well as telephone visits. And again, all very confidential. Some students have had continuing mental health care. In other words, they were signed up with CAPS before the COVID-19 pandemic changed everything. And other students had never been seen at CAPS, but have started to have some counseling visits since COVID-19, even though they may well be at home at the time. And so that's been very important. All this big change that all of you are going through, just like we are, has really been a challenge for students to adapt to this quote unquote new normal that I hope it's not new and not normal, that's for sure. But it's just a challenge in the middle of a semester to be uprooted in many cases from their living situation on campus, be back home where things are different, and that's presented some new challenges for students. And students have reached out, and we've all been able to provide, we feel, a lot of support, and are looking for new ways and more ways that we can support students as they're navigating this crazy new world that we find ourselves in. But we're also preparing, all of us in student health and in counseling, to continue to support students into the fall and beyond. This is just a different way of providing care, and it's something I think that the whole healthcare field around the world, and especially in the United States, is really never going to be the same. And I think one of the silver linings of this pandemic is, I think this kind of care, this ability to provide care at a distance, will make care more accessible to some people, not just students. And I think there are some good things that may come from this that we need to really embrace and build on and become, just develop a more robust and more accessible healthcare system. So that's what we do in student health and counseling. We are here for you. We, again, we try to focus as much as possible on health education. Our goal, we're dealing with primarily young, healthy people, and our goal is to help you learn how to take good care of yourself in every sense of the word. The basics are really important: getting adequate and restorative sleep, eating healthy, exercising regularly, things that are very challenging to do right now under present circumstances, but trying to keep your eye on how important those things are as you navigate stressful times. And we have a lot of very skilled providers in both the counseling center and in the student health center to help you all do that. So again, I want to direct you to our website, and CAPS has their own separate website with everything I've said today. You can find on those two websites. Just a point of information, I think the easiest way to navigate Sonoma State University's website is using the A to Z directory, because sometimes even I have trouble. If you just try to search something on the SSU website, you end up on a web-based search that you don't really want. So if you go to the SSU website, first of all, there's a lot of up-to-date coronavirus and COVID-19 information there. But over on the right-hand corner at the menu on the upper right-hand corner of the SSU website, you'll see a drop-down menu, and go to the A to Z directory. And if you plug in counseling and psychological services or student health, it'll be very easy to link to our website. So there's a lot of information there. Somebody's asked about feminine products. Are they accessible on campus and are they free? The answer is yes to both of those questions. They're always available and free in the Student Health Center, but throughout the Student Center itself, there are products available. Those are provided through the associated students, the student government, and the goal is to continue to keep those supplies stocked throughout campus. In the Student Health Center, we also provide condoms in the restrooms and in all of our exam rooms. If you come in to see us, we want to make sure people have the products that they need, and that they're as accessible from a price standpoint. So they're basically free if you come into our building. Is birth control free? That's a good question. The answer is no. Birth control is not free through the Student Health Center. Instead, birth control pills, we do birth control pills, and we do the Depo-Provera injections. We are not set up, because we can't bill health insurance, we're not set up to do the more expensive birth control like IUDs or implants. And so for those more expensive items, we refer students to off-campus providers like Planned Parenthood or through their health insurance if they have access that way. But we do prescribe birth control pills. You can take, if you have health insurance, then birth control pills are free. But you would have to take our prescription to an outside community pharmacy like CVS, Walgreens, et cetera, et cetera. You can purchase birth control pills in our pharmacy for $7 a month. And that is what birth control pills really cost if you don't mark them up. And so they're very inexpensive to get through us, but they're not free. But again, you can get them free if you come to see us. You can take our prescription to any outside pharmacy and do it that way. Depo is $30 for a Depo injection, and that is our cost. Again, we don't mark those up. Or we work with local pharmacies so that we can call in a prescription for Depo to an outside pharmacy like Costco Pharmacy. The patient would pick up the Depo, bring it to the Student Health Center, and we give you the injection. So that it makes it virtually free. It's a little more work for you as the student to go pick it up and bring it in, but you can buy it from our pharmacy for $30. So those are common things. Here's another question. My parents have an HSA card. Do you accept this form of payment? Yes, we work through that. We are able to, right now, let me back up. In the past, payments were either cash, debit, or credit card, and our pharmacy can work with an HSA card. We're in the process. Right now, we're not accepting any payments in the Student Health Center. Instead, everything we do is being billed to students' SSU account. And so I'm not sure what's going to happen with that in the fall, whether we'll be taking payments directly again or not. But either way, we can work with you on an HSA account. So don't worry about that. It might take a one-to-one conversation, but we'll figure it out and make it happen. We get very creative with that kind of thing, so when we're happy to do so. Great. Well, it's almost 12:30, so I'm going to sign off. But again, I have Partnership Health Plan California. It says, do you accept that insurance? We don't accept any insurance, but you don't need insurance to come see us. But let's say you needed something we couldn't provide, then we can connect you with someone in the community that does accept your partnership. So thank you, everybody, and good luck. And if you have any more questions, go to our health center email, which is centerhe@sonoma.edu. Take care. Bye-bye.